Thanks for being here with us today.
Thank you for having me.
So what is infertility? What does that really mean?
Infertility is the inability to conceive after attempting for 12 months. And we usually differentiate that by a female age. So if you're younger than 35, it's about 12 months of concepting. And it's allowing you to be able to become pregnant with regular menstrual cycles in a certain amount of time. If you're over 35, then it's only 6 months. And this
Why is that? Why is there such a difference?
There's a difference because as you age, your ovaries don't work as well.
Okay.
And in the population, it's about 15% of patients have this problem, and as you said, it's really devastating. So people walk down the street, they see their friend, their coworker, their family member or sister who's pregnant, and if they're unable to achieve that, infertility is a big part of what they go through and have problems with.
You do hear so much about it. I think there's more like freedom in talking about it now, where years ago maybe people kept that close to their heart. But what causes infertility? Why do we hear about so many people struggling?
Infertility has multiple causes, so they can be both male and female factors. So male factors can include things such as hormonal imbalances for men, or difficulty producing sperm, or transporting sperm.
Okay.
And female factors are things such as ovulation dysfunction. So that means having difficulty releasing an egg from the ovary. They can be endometriosis. It could be other things like uterine or cervical factors. And then there's also a component of both male and female factors.
Okay.
It's called unexplained infertility. And we have treatments for all of these things.
Well, that's the encouraging thing. Maybe decades ago, it was just, okay, we can't have children, but now there are so many treatments. What are some of those?
Some of the treatments are oral pills that women take. And so that can be things like Clomid or Letrozole. And there can be those pills added with inseminations, or injections with inseminations, or even up to IVF, which is really successful in our current time period.
That's something you hear so much about now, IVF. Tell us just a little bit more about that.
IVF involves fertilization of the egg and the sperm outside of the body. So we give women injections that they take, and then we monitor them to the point that we retrieve the eggs surgically, and then allow the egg and the sperm to combine in the embryology lab. Those embryos are then transferred back to the woman and allow them to become pregnant.
Now, of course, there are all of these treatment options. However, there is a price tag involved, and I think a lot of couples that may hinder them from asking some questions about this. But with what can be a hefty price tag, how do couples afford this? What are some of the options?
Yes, there are multiple ways now. So insurance companies are covering infertility treatment more and more. So you want to call your insurance company and make sure that you can't get a plan that covers this service. Also, there's something called ARC, which is a fertility financing company that can give certain plans and payment options for patients so that you can use that to have a better financial status for you as the individual.
That is really interesting. I've never heard of that before. That is wonderful for so many couples.